To me, the two most important differences relate to the improved imaging system. So the visualization is much clearer. I can target the tissues of the face better. So for example, what you can see here, the various layers of the Ultherapy cartridge, 1.5, 3 millimeters, 4.5 millimeters. This is the SMAS layer. I'm better able to target it and see it while I'm doing the treatment. This means greater precision, greater comfort for the patient because I'm not going too deep or too shallow, better results because I'm targeting exactly at the right layer of the collagen building tissue. So that's one important. The clarity of the imaging is very important. It's also important to the patient because they appreciate the layer that I'm targeting. Before I do an Ultherapy, as you know, I use the C-plan treat protocol. I'm operating while seeing the layer that I'm treating. Oftentimes, I visualize and I explain to the patient what I'm trying to do. Why is it important to see the tissues of the face? The second key difference is the pulses are 20% faster. And why is that important? Because Ultherapy is thought to be an uncomfortable treatment. Many patients hesitate to do it because they've heard that it's uncomfortable. Well, first of all, the original Ultherapy actually is not uncomfortable if you are targeting the right layer, if you are managing the patient correctly, if you warn the patient. Sometimes it is the fear of the unknown that makes it seem uncomfortable. So oftentimes I'll tell a patient, let's give you a trial, let's make you experience it. But one key important aspect that also softens the discomfort is if they're distracted. Ultherapy is a treatment you don't have to close your eyes. So if you're watching a movie, you're listening to a webinar, which is what I do when I have Ultherapy done, you're distracted. You're not focusing on discomfort. Having said that, now with the Prime, the shorter pulses, 20% faster, the whole treatment experience is much better. Not only is each pulse shorter and therefore more comfortable, but the entire time for the treatment is therefore shorter for the patient. So these are the two key differences with the Prime.